I'm Al McFarlane. Welcome to Conversations with Al McFarlane. And you know, it's all about the neighborhood. This is a conversation about how we build our community, our neighborhood, house by house, family by family. We're focusing on business creation, business development, economic development, and culture. I'm Al McFarlane. Welcome to Conversations with Al McFarlane. Today we talk about an important issue, the issue of health and health insurance. I'm pleased to have Scott Leitz, who's the CEO of MNsure, Minnesota's Healthcare Exchange, and my friend and colleague, Reverend Alfred Babington-Johnson, the leader of the Stairstep Initiative, Stairstep Foundation. Let's jump right in. Scott, MNsure launched last year. It's the state's answer to the Federal Healthcare Insurance Act. Give us a summary, a background of the challenge of launching this massive initiative and how you fared in year one.
Well, it was a big launch, without question. There was a lot to be done in a really short period of time. There were some bumps along the way, but I think in the end, we were really pleased with where we got. Right now, we've enrolled over 280,000 Minnesotans into health insurance coverage. We, according to the University of Minnesota, which did a study on our behalf, reduced the number of uninsured in the state by over 40% over the open enrollment period, which was an amazing accomplishment. We now have the lowest rate of uninsurance that we've ever had in Minnesota, below 5%. But we also know there's still a lot to do. One of the things that we knew coming into the open enrollment period last year was that we had very large health disparities, and that we knew that in particular the African American community had much higher rates of uninsurance than the white population in the state. And so we did some focusing and some targeting there, but a lot more that we can do moving forward. So we're pleased with the progress we've had, but we know that there's a lot more to be done in the coming year.
Let's do MNsure 101. What's the background from the federal point of view? What's the government's intent in providing this version of close to universal health care?
So what the Affordable Care Act did was set up a framework that was intended to drive towards near universal coverage or universal coverage. And it did that by requiring that all people have health insurance coverage. There's a requirement that was put into the law in Minnesota. There's a requirement that every Minnesotan have coverage. The way that they're helping to facilitate that is two ways. One is the federal government allowed states to expand their Medicaid programs and make more people eligible for public health insurance programs. But the other thing it did is it allowed states to set up state-based health exchanges, which Minnesota chose to do. We are one of 14 states that chose to establish our own health insurance exchange. And what insurance exchanges are intended to do are for those people who aren't eligible for Medicaid, it provides a forum for them to receive tax subsidies to help them purchase commercial health insurance coverage. And so in Minnesota, what we did is we established a portal called MNsure. It's a place where people can go. They can have their determination made of if they're eligible for Medicaid, if they're eligible for our Minnesota Care program. We get them enrolled in those programs. And if they have incomes that are above those levels, we help them enroll in commercial coverage, either with a subsidy or without a subsidy. But it's really the mechanism intended to get people into that health insurance coverage that they're now required to have.
For the sake of background, there were arguments against the strategy at the federal and at the state level. In fact, legislators at both areas want to rescind or repeal what they call Obamacare. What were the arguments against this strategy, and what do you think were the prevailing arguments for it?
Well, I think the general argument against the health reform generally is that the system didn't really need it, that the U.S. had the best system in the world, and that we didn't really need to have that. I think the thing it overlooked was that nationally close to 50 million Americans didn't have health insurance coverage. Here, close to 500,000 Minnesotans didn't have health insurance coverage. And for the system to really function well, you really need people to have that coverage so that they're accessing care at the right time, at the right points, they're staying healthy, and we have a more productive economy as a result of that. I think the arguments in Minnesota for establishing a state-based exchange as opposed to us going and just defaulting to the federal exchange really revolved around the fact that we have a very good health system in Minnesota, and there was a strong view that having control locally was more important to us than having it done at the federal level. And I think that was a wise decision on the state legislature's part.
Babington, join in here if you would. You know, Minnesota is known for being one of the healthiest states in the country, one of the best educated states in the country, one of the most economically solvent and sound states in the country. But we also have this problem, it's a black eye, if you will, in health care disparities, in health insurance disparities. Scott mentioned that. And so what's the background from the point of view of our community? Why is it important that we embrace and engage our community to understand healthcare and to use the service that MNsure provides?
Well, you know, Scott, as he was sharing, used a term that I really appreciate and want to glom onto. Mm-hmm. He spoke of MNsure as being a portal, an opening, an access point, if you will. And the underlying issue is health insurance. The underlying issue is, are people in our community able to obtain health care? Well, clearly, cost is a major factor to that. And regrettably, too many people in our community, for one reason or another, are not, have not had historically access to health care in ways that made any sense. We were emergency room too often in terms of health care. So the question is, how do you cross the divide and get beyond reluctance to have health insurance, or feelings that you just don't understand it and you don't access it? So what did occur for us, Al, as a community, as MNsure was rolling out, we felt it was very important to engage African American people in a conversation that really struck at some deep chords about why we were perhaps not as involved in healthcare. And as you know, our history in this country is we didn't come to the United States as those who bought and sold. We came as those who were bought and sold. So the whole financial fabric of the community was one in which we were objects, not involved ones, by our own power, by our own wisdom, etc. So when something comes up like insurance, insurance is really a financial vehicle. It's part of the whole structure of things. And we have been so abused in some ways by the system historically that I think there was a built-in resistance to engage in this. We saw insurance salesmen often as like car salesmen, folks who would take advantage of you in one way or another. So the opportunity that came with MNsure was to take on that discussion very directly and try to have our folk understand the history of it and the opportunity that MNsure now provided.
You did some novel things. You helped develop in Stairstep and in conjunction with other legacy institutions in the Black community and in communities of color, a navigator system where you hired, trained, and dispatched people to go into the churches, into our social service agencies, to tell the story and to motivate people to understand and embrace the opportunity at hand. Talk about that for a second.
Well, clearly, African American people represented about 17% of the uninsured in the state of Minnesota. So we had big work to do, heavy lifting to do. Based on the notion that we were disconnected from the marketplace, the question is, how do you get connected? Well, one, you try to understand the history of it, but secondly, that trusted voice is critical. And in our community, for various reasons that are part of Stairstep's long-term mission of community building, we recognize that there is this potential in our community for healing and for impact that is the African American church. Mm-hmm. It's got historical credibility. If you look back at any social movement in our community, the leader of that movement was the African American church, civil rights movement being the most recent case in point. So when the opportunity came through MNsure to do outreach into our community, we thought it made a lot of sense to try to use this organic instrument in our community, activate it with wisdom and knowledge about the issue itself, and then create the mechanism, navigators, within the church that would both reach out to enroll people, but also to inform them. So we were able to do that with support from MNsure.
Scott, was that a hard sell on behalf of the black community and communities of color? And I raise the question because as often as not, people who bring ideas to the table, to the marketplace in our community often get shut down. They get ignored. Our experience is marginalization, benign neglect, those famous words. And so it's both great and encouraging to see an institution like MNsure embrace the genius of our community. But let me ask you from the director's point of view, was this a hard sell or no-brainer? And how have you discovered your ability to interact with organizations like Stairstep and other legacy institutions in the black community?
Well, we knew it was going to be very important for us to work with legacy institutions in the African American community. I think as the Reverend Babington mentioned, we knew that there was a high rate of uninsurance within that community and a long-standing high rate. And so for us to make progress as a state, we needed to make progress there. It was critical that we engaged with folks who are trusted in the community, folks who are trusted and understood, and the right legacy institutions to do that. And it turned out to be a really, really wonderful experience, I think, from MNsure's perspective. I think we always felt embraced as part of the process. It was us understanding how best to work, I think, in various communities. That was probably the more difficult and bigger challenge. But I have to say that the patience and the open willingness of institutions and communities to really be patient with us as we learned how best to work with communities was really great. And the leadership, such as was shown by Reverend Babington, was really critical in helping us do that.
So what are the targets going forward? We'll have open enrollment coming up in November, I believe, October?
November 15th.
November, and that goes through about March, I think, 31st or March 15th. Which one is it?
It'll be February 15th this year, so it's a little shorter open enrollment period.
And so what does that mean? And what should people be listening for? If you have insurance, what does it mean? If you don't have it, what does it mean?
So 3 things I want to really mention with regards to that. First of all, the one thing to remember is that for people who are eligible for Medicaid or Minnesota Care, open enrollment is all year round. You can, if you're eligible for those programs, you can come in and get coverage in any month. You will have to at some point renew that coverage. It's a year-long cycle for that renewal to occur. The second thing to remember is that people who purchased on the commercial side, meaning they weren't eligible for Medicaid, they weren't eligible for Minnesota Care, and maybe bought what's called a qualified health plan, which is commercial health insurance coverage through MNsure, that renewal period is coming up for them. If they came into coverage in January, they'll need to renew that coverage in January. And so we're working on methods to ensure that people understand how best to do that and what they need to do in order to do that. But the third, and I think important thing here is, as we come up on this open enrollment period starting November 15th, we're going to be working really closely this year. We learned a lot from the first round of outreach grants and navigator interactions that we want to learn from this coming year. And so we will be having a second round of grants that we'll be announcing in September to organizations to really focus on getting people into coverage. We're doing that with an eye towards trying to fill the remaining gaps that we have. That means focusing on communities of color where we know there are remaining higher rates of uninsurance. It means focusing on barriers that individuals might have in getting into that coverage. And it means working, again, hopefully more aggressively and in a continuing partnership with community-based organizations that we had some success in the first round, but learned, I think, even better ways that we can do it the second time around.
What are your targets? What numbers do you need to say this is a success for our state and for the agency?
Well, I think we're hopeful to have another 50,000 people in addition to the initial 50,000 that were enrolled in the qualified health plan side, so that'd bring us up to close to 100,000 as a goal. But we also know that there's great opportunity to continue to enroll people in the Medicaid program, and we haven't set specific targets there. I think the main thing that we are looking towards is if we were able to reduce the uninsurance rate by over 40% this first round, we'd love to have another 20% additional reduction this coming round.
Babington, what's the impact of reducing the uninsurance rate? I mean, that says a lot for our community in particular. You mentioned that we have had the experience of thinking that the emergency room is the place we get care. And we haven't had an attitude towards getting insurance and being proactive, being healthy, health conscious, doing intentional things to stay healthy. So what kind of impacts do you see besides getting insurance or what does getting insurance mean for us? It's a difference, right?
Well, it is a difference, Al, and something I think that you and I have shared over the years of our collaboration is recognizing that we are facing complex situations, and no one issue that confronts us is separated from the variety of other issues, the myriad other issues that confront us. So our concern is always, how do you take on an issue in a way that has impact beyond that issue? How do you take on an issue in a way that it helps our community, but it has impact beyond our community?
So explain that in this context. What kinds of connections or extensions are there of engaging proactively around health insurance that have collateral benefit?
Right. Well, you and Scott mentioned the issue, for instance, of legacy organizations. So I was really very impacted by people like Assistant Commissioner Gene Ayers of the Minnesota Department of Health and others who have taken this conversation about health itself and said that the major issue around health is not cough syrup and Band-Aids, it's about the social determinants of health. So in other words, if you tell me what your zip code is, I'll tell you what your life expectancy is.
How long you'll live, yeah.
Yeah. So there's all kinds of issues woven in there. And so if we are able to take on the issue of health insurance and the need of it in our community in ways that also builds capacity within legacy organizations in our community to do a variety of different things, in a way that also helps people have better economic outcomes, either by virtue of the fact that they have a position now to work in. All those things are interconnected with the real issues that we face. But in addition to that, Al, I think there's a great service that we as African American people have rendered in our community and can render. And this new outreach opportunity with MNsure, we're aspirational about that. We hope to be involved in that, but we think that there's more value we can add in that regard, and specifically in this, and something that you know being your use of media. There's a group of people that MNsure is concerned about, and we are concerned about. They call them the invincibles. I call them the immortals.
The 25-year-olds.
These who think that they will never die, nor will they ever get sick.
Like we did. Like we did.
And once upon a time. I still lean in that direction. But in any event, that group is really impacted uniquely by African Americans beyond the African American community.
Hip-hop culture.
Hip-hop culture
Global. Yeah.
is global.
It's a mindset.
For the immortals,
That's
for
right.
the invincibles.
Absolutely.
So our aspiration in talking to MNsure is we think we can uniquely deal and impact our community of immortals in a way that has ripple effects throughout the community. You know, that's what we intend to get after.
That's phenomenal. That's great. So what do you think, Scott? I mean, I'm excited hearing this, but how does that resonate with you?
It resonates very, very well. We've been really honored to have a partnership with Stairstep and the work that the Reverend is doing, and I think the really, really innovative ways that they're thinking about how to reach that young group of individuals, and as has been said, really cuts across, I think, racial and ethnic and income lines in a way that can be really, really impactful. So we're really pleased about that.
Well, to go deeper on that, both nationally and in Minnesota, the question was whether young white men would sign up. And this was the target that was the hardest to reach. Young black men and black immortals, you're saying, Babington, impact the mindset through the power of hip-hop culture.
You know, Al, some few years ago, I was sitting in the Mall of America, and I looked out, I was in the food court, and I looked out, and there was a young Asian American in his teens, and as I looked at him, there was no difference in his apparel and his demeanor than my son, who was in the hip-hop culture. Right. It does cross all lines, and I think we gain wisdom when we have these sorts of insights that help us to understand how to impact people practically, but also emotionally. And I think that's what can happen here.
Scott, we're out of time for this segment, but I thank you so much for being here. I want you to leave a word for our listeners, our viewers, on, again, reminding them to connect and how important it is and what the benefit will be for our state and for them.
Well, I want to remind people open enrollment starts November 15th, and the requirement is that people have health insurance coverage. But the more important issue here is that as people get that health insurance coverage, it lets them live lives that are less worried about getting sick, and that they know that they have that peace of mind and are able to stay healthy. We're, again, honored to be working with various legacy institutions to help get that word out. We've enjoyed the work with Reverend Babington and his organization, but really want to expand on that coming into the fall.
This might not be the appropriate question. I'll ask it anyway. Sometimes our listeners, our community, needs to have a sense of what we can do to make sure that the policies that are benefiting us are maintained and not threatened. And this question of healthcare has been a boiling point. How do people who feel this is a strategy that enables our community protect it?
I think they need to ensure that they're engaged with their elected officials, making sure that their voice is heard. It's as simple as a phone call or an email to that elected official and let them know about the importance of the issue just from a pure legislative directive. And that means at the congressional level, all the way down through their appointed officials at the more local level.
Same question, Babington, summarize if you would.
Well, absolutely. I just affirm what Scott has shared. I affirm the notion that we need to more and more look to ourselves to step forward on our issues, to build our own institutions, to engage politically. We're so grateful for Senators Bobby Joe Champion and Jeff Hayden and Representative Rena Moran and the great work they're doing for our community. We need to continue to be advocates for empowerment, capacity building in our community.
Thank you so much. Reverend Alfred Babington-Johnson, Scott Leitz, thank you so much. Stay tuned. I'm Al McFarlane. Welcome back to Conversations with Al McFarlane. We talked in the last segment about legacy institutions. Legacy institutions, to me, are the bedrock of creating health and wellness in our community. I'm pleased to have in this segment leading organizations, representatives and leaders of leading organizations that mind the health of our community. I often say our health is our business, and these leaders take our business seriously. First of all, Stella Whitney West, the CEO of NorthPoint Health and Wellness in North Minneapolis. After we talk to her, we'll talk to Bill Tendle, who is the CEO of Southside Medical in South Minneapolis, and their colleagues in St. Paul. Roxanne Tisdale is a member of a team that includes her colleague Char Lankfard. They're both with the Open Cities Health Center. And I think the new name is now Roxanne Roby.
Amen.
Okay,
Yes.
all right.
Amen.
Congratulations.
Thank you.
Thank you. First, Stella Whitney West, thank you for being here, and thank you for NorthPoint's position, its impact, and its power in the community. But I'm going to ask you to describe, number one, what is NorthPoint, what it does, and how big an impact it has on our lives in North Minneapolis.
Thank you, Al, and as always, it's a pleasure to be here with you. So NorthPoint Health and Wellness Center, and some people know us as Pilot City. We are a community health center as well as my colleagues here. We have been in North Minneapolis since 1968, so we're coming up on 48 years in the community in the same location. And we provide comprehensive healthcare services, so medical, dental, behavioral health. We also have an on-site pharmacy. We also provide, through our nonprofit, assistance with housing employment. We have a food shelf, so addressing what we call the social determinants of health as well. So we serve about 23,000 patients on an annual basis, and about another 10,000 come through our nonprofit for services, and about 86,000 visits. So we think we're having a significant impact in North Minneapolis. One of the things that we're doing and focusing more on, because our mission is partnering to create a healthier community. And so what we believe is that in order to have a healthier community, we have to be in partnership with the community. And that says that extending beyond our campus, beyond our four walls, making sure that we have a strong outreach, particularly in Minnesota during the summer, as my colleagues do the same, is that we are out at almost every community event. If there is not a community event, we will invent one.
You've got a big one coming up.
We do.
Take a minute and talk about what you're doing in September.
Okay, September 13th is our third annual Fit for Fun. And this was an event that really got organized by our staff. Our staff are always giving the messages to our families about increasing their physical activity, having access to healthy foods, making sure that they're making those kinds of choices. And then they realized that there were not a lot of good opportunities in North Minneapolis where families could actually have those kinds of behaviors. And so they decided, let's have an event, we call it Fit for Fun, so that families know that you can have healthy activities, you can do physical activities in your community. Doesn't cost anything to get out and walk. And so that is what we have done. We've also done it in partnership with Insight News, the Insight to Health, making sure that people have access to excellent trainers, Tyrone Miner and his staff, and the success stories that have come out of there, that people can see people that look like them, can see them active in the community, can see that they have been able to change, and can hear the stories about how people have decreased their dependence on medication, been able to lower their blood glucose levels by changing their diet and exercising. All the things that we have been telling them to do, but now we've made the connection and said there are places in your community where you can get the support to do that. So on September 13th, we clear out the parking lot, we put up a big tent, we have line dancing, so we have activities for everyone. We do a 5K walk-run event in the morning. We also do a bike tour with Major Taylor Cycling.
Great organization.
Great organization, and we have an ongoing relationship with them. So you'll see Major Taylor every Thursday. They do bike rides from NorthPoint. They're doing this historical bike ride as well. So, and we have a relationship with the Nice Ride. Our staff are taking the lead, and they decided, well, if we're going to tell other people in the community to get healthy, we need to get healthy. So we have staff that are enrolled in the Insight to Health. They're also doing a boot camp with E.J. Henderson.
Fantastic.
Riding bikes during the lunch hour. I was out yesterday on the Nice Ride. You know, I was like, oh, I haven't been on a bike in 30 years. But, you know, so it is true that, you know, you never forget. So it took me a minute, but I got on there, and I was doing it. So we encourage people to come out. There's activities for every age level. And going back to those old games that we used to play outside, hopscotch, hula hoop, you know, all those things that kept us as kids healthy. I mean, we were never inside. We were always outside, active.
Yeah, that's amazing. Now, you mentioned my Insight to Health Fitness Challenge with Tyrone Miner. We're doing that right now. We're finishing up this series. The next one begins in September 13th, I think. Next 10-week challenge begins. But last week, believe it or not, Al McFarlane at 66 years old was playing tag. Tyrone sets out 5 hula hoops and put some balls in them. You got to go in and try to grab and steal. And move.
Okay.
So the point is, you know, these are things I did when I was 7,
We
6,
saw, right.
but now at 67, the same thing, but it gives you energy, it gives you
Yeah.
focus, it gives you agility, but it tells us that we should get back to, if we intend to have a quality and long life, we got to get busy.
Right.
Bill and me
Right.
talked about Southside, and thank you so much for being here, Bill Tendle. A great institution, a great organization, a widespread campus, I think. Talk about Southside, what the mission is, and what value you bring to our people in our city.
Well, one of the things that we try to do is to make sure that people are in charge of their own health. And part of doing that is to allow people to come into our clinics and just talk about what they want to talk about. We try to have an open door policy with that. And one of the things that I wanted to talk about today is about MNsure. We really did a special program for all our staff for MNsure and the MNsure sign up. And that was, we had our patient advocates signing people up. We had our community outreach workers signing people up. We had our anybody that our front desk, you know, people signing people up too. So we wanted to make a really impact in that. And I know that people were really interested in getting that information. And sometimes the computers didn't work, but we had people working after hours, sitting to make sure that as many people as they could get signed up for that. But the other thing that we do, and I know that Cheryl knows a lot about this, is that we have a community outreach van called a community van. And that is a partnership with the other community clinics. So we've done things with NorthPoint, we've done things with Open Cities, and we always try to share. We go into other communities and we refer people to the closest community clinic that's in the neighborhood, because that's the most convenient. We've had a dramatic impact. We've had people that have had high blood pressure. We took them right down to the hospital, or we made sure that they got there. And so we focus, much like community clinics do, is to do a lot of preventative work. And we'd like to enhance that, you know, working with the other community clinics to make sure that we can do more preventative care. Because one of the things that our population doesn't have enough information about is how do we prevent these diseases, especially diabetes, obesity. They just don't know. People don't know. And we have to find ways to better educate people. And that's some of the things that we should sit down and talk about.
Open Cities in St. Paul is like NorthPoint and like Southside in that it's a highly regarded, very visible, very engaged institution. One thing that's common about all of you is that you are governed by the community and that you are led by African Americans, but you also all have and exemplify this notion of diversity. All of you have a very diverse customer and patient base. You're head of the prenatal coordinating program. You're an RN.
I am an RN, yes.
Roxanne.
Yeah.
And, you know, talk about, from your point of view and within the organization of Open Care, how critical is it that we have institutions like Open Cities Healthcare for our people?
Right, and it is very critical, Al. I think one of the things that are critical is that people see us doing for us and serving us. And one of the things that I'm really proud of at this table that is a bond between all of these clinics is that we come with the servitude attitude, right? And to serve the people and to serve people at their needs, and that we turn things around from a Western culture point of view. If they build it, they'll come kind of thing, but that we really go more on a roots Christian level, and we go out to the people and we see what the people need and want, and deal with people and meet people at their needs. And who could better do that but than someone who knows my lifestyle, knows my culture. It breaks down barriers. We don't have to cross so many barriers, right? I know what greens are, and yeah, we can sub together. We don't have to figure that out to break that barrier. And so we all know what the same streets are. We've all been downtown. We were talking about that today, growing up and being downtown and some of the changes. So those are barriers that we don't have to break when we go serve people.
So let me ask you both, you and, did I mistake, Char, are you the prenatal care?
Yes.
Okay, I've given.
I was like,
apologize. You're the prenatal care coordinator
Yes.
at Open Cities. But let me ask you both, and I'll take your words. You say we know what our people need. What do our people need? What are you finding out as you serve our community? What is it we need to be healthy, to be whole, and to be engaged? What do you think?
Good communication, and also the patient need a liaison between them and their provider, and that also helps too. And then with their social needs, they may need housing, they may need food, and we're there to help them with those needs. And they know that we're there, and so they come. And when they get the services that they need, there's a greater outcome. And then word of mouth is spreads, and then you get more people coming in.
Are our people, from your point of view, generally afraid of healthcare institutions? Are we afraid of doctors, or are we changing? That used to be what I heard a lot about. Our people simply were afraid of organized medicine, and the basis for that might have been in the South and in history, we were treated rudely or not treated, and therefore we said, you know what, I'll just suffer and I'll pray, you know, and the Lord's going to take care of it. But then there's a doctor that knows how to do that, and we tend not to go till it's too late. Is that's still the case, or is that?
I see that changing. I see a lot of our people are definitely coming in to see their providers now, and they're communicating with them, you know, letting them know what their needs are. You know, it used to be like if you write down a list because you might not know what to say once you get there, but you write down the list and you go in, talk with your provider. And what I've experienced at Open Cities is that the providers are really listening to the patients, and that's what's really keeping them to come back and be more aware of their health issues.
Right. And also what I find, if we're here, those that are at the table, myself as an African-American woman, if I see other African-American women, African-American men, I tend to trust a little bit, right, sooner. And so we need to take care of us, right, and trust in us. And I have said to folks, even with the flu shots, and they've said, I don't know, this could be a Tuskegee thing. And I said, I've given it to my children. I've given it to myself. And so I'm not asking you to do anything that I haven't done or given to my kids. And I'm not giving you anything that is wrong. I gave this to my baby.
So part of this is teaching our people to ask questions.
Yes.
Because the other part of what I was saying was that in history, I think, and in the past, maybe some of my life, we were raised to believe that the medical professional was like a god, and you didn't dare question the policeman, the teacher, the judge, the doctor, the dentist, you know. And so you would suffer, and you present yourself with ailment of some sort, and you'd surrender to whatever they chose. And you were encouraged not to interrupt or interfere with their intelligence. Am I saying that wrong?
No, you're absolutely correct, and also you would find that because there wasn't that two-way communication, a lot of the protocols were not being followed. So because sometimes there's that, just because there's that lack of communication, I think what community health centers, what we bring to the table is that we are rooted in the community. We hire people from the community. And so when people walk into our clinics, there's a sense already that these are people that I know this feels like home. I'm comfortable. I can have a conversation. And I'm not just sitting there listening to someone tell me something and I'm intimidated. I'm not able to say, well, this is what I believe in. And if you don't have it at a conversation level, you never get at why someone won't adhere to a certain protocol or why there's difficulty either in their household or within their community. And we're finding that that this is true across the board with communities of color, not just the African American community, but other communities as well, as they have migrated here, that they have some of the same fears that African Americans have had. And then I think what's unique with our community is that we have had this history of mistrust because there were real abuses, there were real efforts to give us erroneous information or lack of health care and treatment. And that was a pattern that the American Indian community experienced as well. So and that takes a long time to overcome that. I think the more and more community health centers that have people of color that are working there, we're able to make some inroads. But it is still an issue.
Part of the business built Tendle of operating a community health clinic is that you got to have a financial model that works. And part of that is challenging legislature or the county or the market to make sure that you have the resources you need to deliver the services that are needed. How does that work? And what are the challenges for you?
Well, the challenges are, a lot of times, is just getting paid and getting paid on time, but then sometimes you have internal problems that can restrict your payments. That's one of the things we've struggled with for the last couple of years, where we're just now coming out of that. But we had to hire new people and change our model a little bit. And one of the things that Stella brought up is that making people feel comfortable. And one of the things that we've done is, first of all, we interview people 3 or 4 times when they come into Southside. And then the second thing we do, we tell everybody there that healthcare is about building relationships. And I think we all agree with that. And so when that patient comes through the door, we're building a relationship with that patient. And so that they know when they come into our clinics that they're going to be accepted, they're going to feel comfortable, that we're going to help them the best way we can. And if we can't help them, we're going to refer them to the people that can help them. So those are the challenges mostly.
I think another challenge, and I'm just going to piggyback on what Bill says, that community health centers serve uninsured as well as insured. And we have always had a legacy is that we will serve and we don't turn anybody away because of lack of insurance or ability to pay. Certainly in Minnesota, that has a higher insurance rate, and with the Affordable Care Act and MNsure, we're able to sign up a lot more people and get them insurance, but there's always going to be a segment of our population that is still going to remain uninsured. And the community health centers are the ones that are able to serve that population, and we don't turn people away.
Char, you're going to say something? What was you had a comment you're going to make?
I didn't, but.
Okay. Well, so, go ahead.
Well, we even also have like the sliding fee scale at Open Cities too. So if a patient comes in and don't have insurance, we'll still try to meet their needs. And that's what I was going to say. You know, so we don't turn anyone away, but they can definitely be seen by medical, dental, behavioral health, any of those entities at Open Cities with or without insurance.
Bill, you all did a recent parade in South Minneapolis, and part of this issue is branding. Branding is making people aware, making people comfortable, making people know who you are and know that you represent them, you serve them. And you've got a wonderful program, your partnership with UCare and others, right? To do the Human parade and event. Tell me about that.
Well, Human was on I think, July 12th. Or was it June 12th? I can't keep the date straight.
July.
Okay, thank you. Okay. But it was a great event. We partnered with Medica on that, and UCare, and with the Human. The Human's been going on for about probably about 3-4 years, and it's really been a good program. And I think they've tried to incorporate a lot of other organizations into that as we go down, go through that process. And it was really fantastic. We closed down 4th Avenue, And if you know the history of Southside Minneapolis, they used to have the 4th Avenue Parade every summer. And that was always a big event. And I rode on the float one year when we had it. And it's just fun. You get to go through the neighborhood, you get to see people, people get to see you, and they know that you're part of the community. And one of the things that we're trying to do now is help people know that we're part of the communities we serve. Because sometimes people just don't know. They say, I've gone down by that building a lot of times, but I just never look to see what you do. So.
And I think, again, the Human is a really good outreach into reaching men of color. I know it's one that we certainly appreciate because oftentimes women tend to be the ones that come into the clinics and get the preventative care, and they're usually bringing in children. And sometimes it's a little bit more difficult to get men in, and so having programs like Human helps us do that outreach. We have a walk-in men's clinic at NorthPoint as well, and we have community health workers, and they work a lot with the other clinics, going out, getting men to come in. I think having easy access to health care for men is particularly important, and making sure that there are men that are there providing of that care.
Yeah, NorthPoint and, go ahead.
Excuse me,
Bill.
I
Sure.
just want to make a point about that. We did a survey with a woman from the University of Minnesota, and what we found out is that at any of our outreach events, 52% of the people that were there were women or females, and 48% were men. And we saw that as a great opportunity for all of us to impact men's health. So if we're taking blood pressures, blood sugars, BMI testing, that is a really great advantage to us in hitting the male population.
I want to ask you for the next 5 or 6 minutes when we close here to put on your dream hats, your dream mind. And I want you to envision and describe what optimum health would be in our community. And the background for my question is something I said earlier in the day. I talked about our health as our business. It seems to me that if we are beset by what they call these health disparities, what we really have is a great opportunity. And that is there a way for us to examine the problems and find solutions that are also providing financial benefit as we solve the problems? Can we be part of the solution side of the equation? I think about how wonderful it is that Mayo Clinic is working very hard to solve cancer and heart disease, but in the process, billions of dollars are being aggregated to attack problems. We've got huge problems, and can we not aggregate the resources we need to employ our people, our researchers, our doctors, our service providers, our support teams to help change our community from being one marked by disparity to one that represents the finest, best case for a viable, healthy community? Stella, what do you think?
Oh, absolutely. I've always, I have a background in business administration, and I've always looked at opportunities where the business side of health can be leveraged in the African American community. So when you look at that it's a multi-billion-dollar business, how do we make sure that we are also the ones who are running that business side as well? And part of that says that we've got to have a pipeline to making sure that we are getting our young people into health careers. Health as an industry is an industry of high demand, high growth, and making sure that they understand that there's a vast number of careers in health. It's not just the doctors and the nurses and the dentists and the psychologists, which is all well and good, and we want those as well, but there's opportunities in pharmacy, laboratory, research. There's opportunities and at all different levels, and that pay really good pay and benefits. So we want to make sure that there's an opportunity there. And I think too that when we talk about health disparities, I link it to the health inequities, and we have to be real clear is that it is because there was the unfair, we call them even discriminatory practices, the institutional racism that created the health disparities. And so
don't blame ourselves.
exactly,
Right.
exactly. But at the same time, that doesn't say that we should just sit down.
Take
because
responsibility.
we have take responsibility, educate yourself, because it is life and death, and it is about making sure that our community is healthy.
Bill Tendle, what do you dream when you think about, if things were perfect, what would they be like for our community
I love
and the
that.
organization?
I love that question, I have to tell you, because I've thought about this a lot since I've been in healthcare, and I've been in most of my career, but I look at our clinics, and we all should look at our clinics as not just a community health center, but a community resource, because that's what we are. But even more than that is, and what we have to start working on is, we have to work on having some job programs or some job information that we can help people get jobs, because people don't come into clinics if they don't have jobs because they're worried about money. Then we have to make sure that people get a good education, because as quiet as it's said, most black people want a good education, and they want to trust the people that are educating them, and sometimes that's a hard thing to do, just like they want to trust the people that provide their health care.
Right.
And then the thing after that is that they get a good education, and we know they're going to get good jobs, and they're going to have opportunities. So all the other clitter-clatter we hear around, healthcare is the bottom line of this, and as health organizations, since we do have some leverage, those are the things I think we should be focusing on. Perfect scenario for me is if I could get everything lined up like I want to. And I've tried to do that. I've tried to provide more services. We have vision, we have eye care, we have dental care. We partnered with another company to do behavioral health services, and we provide our medical care. But there's other things that we've looked at and said, if this person can do this for us and bring it into our organization and partner with us, how do we make that work? And that's what we all probably are going to be looking at from now on.
So, Char and Roxanne from Open Cities, as you dream, I'll ask you both together to take tag team on this.
Okay.
What do you envision, and what would be perfect for you from the knowledge you have about making our community healthy and whole?
Overall, I would like to see, we have a lot of components at Open Cities too, and I would like to see housing, real stability for our patients that really need it, and not just a phone call to a dead end, but a phone call that's really going to change somebody's life, and it's going to give them affordable housing in a reasonable neighborhood to raise their family. Because if they're not getting some of their social needs met, that can also mess with their mental ability and also their physical.
And I think one of the things to wrap it up, maybe for me, that we're all saying, is that Maslow hierarchy of needs are met in our community
Explain that.
across the board, so that housing is met, the basic needs to survive are met, the housing, the food, clean water, shelter, that all those things are met, that you feel safe in where you live, right? I'm not going to go for a walk and be healthy if I don't feel safe, right? We're not going to go to that playground even if it's there, so that all of Maslow hierarchy of needs are met, so we can start moving up and start focusing and doing other things, that we can now do education right? And not have to be in survival mode and worry about housing, worry about food. And even if I have insurance, $25 can be rough, right? And if I have more than one kid, that's $50, $75 as a copay. That can be really tough to get there, to match that. And if I have to make a choice between that and using that $25 for gas to get to work, right? In America, I shouldn't have to make those choices, right? So all our basic needs should be met. And that is the start for me of a healthy community.
Down to a minute now, let me ask each of you to invite our listeners to visit you at your institution. So Roxanne, you invite people to Open Cities.
All right, well, amen. So I invite everyone to come just to see the facility. It's a beautiful facility. It's 409 North Dunlap. We do have chiropractic there. We do have dental, mental, medical services that go on there 24/7. We have podiatry. We have internal medicine. So we're trying to look at patients in the community as a whole being, as a whole person. So please come. You are welcome to come. Tell them Char sent you. There.
Bill Tendle, same thing, Southside, do the invitation if you would. I think our people need to be invited.
Well, welcome to Southside.
All right.
That's what you should get.
All right.
But Southside has a clinic on 35th and 4th Avenue. It's in the Green Central School. That's our largest clinic. But we also have a dental clinic at 4243 4th Avenue South. And that's all dental. We do implants. We do extractions, oral surgery in there, and then general dental care. We have a new clinic we opened in Richfield. It's pretty small, but it's just a medical clinic. And then we have another small clinic in Stillwater.
Last minute, Stella, Whitney West from NorthPoint.
Well, well, first of all, I would invite everyone to come out to Fit for Fun, Saturday, September 13th. Registration starts at 9 a.m., but you can go to our website, and that's northpointhealth.org to register, and you can see all of our services and hours of service, but we are located, our main campus is on Plymouth and Penn in North Minneapolis. So I echo what everyone else has said, you know, well, any one of these clinics, you will find the same reception, a warm reception. So.
Thank you all for being here, and I toast and celebrate and salute each of you, your work, your institutions, and on behalf of the community, thank you for your leadership in serving our community. That's it for today. I promise, as always, a robust conversation. I think this is it. Stay tuned for more conversations with Al McFarlane.
Thank you, Al.
Yeah.
Here's a quick insight to health tip for a workout you can do at home. Whether you're cleaning, whether you're just walking around the backyard, pick up your pace. If you do something for 20 minutes to getting your heart rate up, you're gonna burn some calories. And again, although we like to have you in the gym, if you can't find the time, you always have 20 minutes in every day.
Quick tip from Open Cities Health Center on how to lower your blood pressure. Eat foods with less salt. You can try and exercise, avoid alcohol, avoid tobacco, and try and get on a regular sleep schedule, and try to manage your stress.
Quick insight to health tip. Guys, you want to make sure you have water in your system. One thing we do at the Fit Lab is make sure that people bring water and we charge them for water whether they don't have it or not. Reason being is you have to prepare. If you don't prepare for your day nutritionally and have water in your system, it's not going to happen. Drink water, eat healthy, live good.
Good evening, ladies and gentlemen. We got to say goodnight. We want to thank Al McFarlane for bringing us all those great words and all our lovely guests, all the guests in the house. Everything's good, you know. So I want y'all to tune in every Tuesday morning, right around 9 o'clock. Cause we're gonna play you a song. All the guests will be home. We'll be feeling like talking. Have a robust conversation. conversation. Cause this thing he said, the message is clear. Everybody knows we gotta keep it right clear. We just go